Hi, I'm Dr. James and I want to talk to you about exercise in the management of PMS or premenstrual syndrome. It's a very good natural remedy. Now, of course, premenstrual syndrome is a sort of a cluster of variable symptoms that can affect women about 7 to 14 days before their menstrual flow begins. And sometimes even during menstruation, there are very painful menstrual cramps, or what we call dysmenorrhea, as part of the whole complex of things. And PMS is quite prevalent. About 1/3 of women who are premenopausal actually have some PMS symptoms, especially women between the ages of 25 and 40 years old. And about 10% of women have very severe, almost debilitating symptoms. And this is why it's important to understand what you can do for yourself to help manage this in an effective way. So, of course, with PMS, the constellation of symptoms can affect different body systems, if you will. So there can be emotional symptoms where you feel depressed, or there's anxiety, irritability, mood swings. There can be gastrointestinal symptoms where there's bloating or constipation, diarrhea, food cravings like for sugar or for chocolate, not uncommon, as you know. Reproductive tissue can be affected, breast swelling, breast tenderness, of course, menstrual cramps, changes in libido, not uncommon. And there's other physical manifestations. If you're prone to headaches, often that's when they're going to occur. If you're prone to low back pain, it often will be magnified. Skin lesions often occur, swelling of the fingers and in the ankles. So these physical manifestations are extremely common, and some women have some as opposed to others, and some have a greater number. It seems to vary. But the question is, what's causing this to occur? The most common underlying factor that we see consistently is an imbalance between estrogen and progesterone, a very high estrogen to low progesterone ratio. And so how does this happen? Well, faulty dietary behaviors can actually raise your estrogen levels too high. Or sometimes the liver's not detoxifying old estrogens in an effective way. And so some lifestyle factors can help to correct that. As well, sometimes in the ovaries, they don't produce enough progesterone from what's called the corpus luteum, which is responsible for progesterone secretion in the second half of the menstrual cycle. Sometimes there's ovarian failure from that standpoint, but that too can be corrected, and I'm going to help you understand how all that works. But that estrogen-progesterone imbalance is at the root of what happens next, because that imbalance then causes a drop of endorphins in the brain. At least that's what we've seen. And that then accounts for mood swings and depression and anxiety and just the change in how you feel. Also, that imbalance can lead to an increased secretion of prolactin, which can cause breast tenderness and aggravate even fibrocystic breast disease. And the imbalance of estrogen and progesterone can also do some other things that can cause aldosterone to be secreted, which then holds water and salt in the body, so you get the bloating and the swelling and all of those effects that are extremely uncomfortable. It feels like there's weight gain happening. The medical treatments, and I don't like any of them to be honest with you, include things like giving women oral contraceptives to sort of override all of her own natural hormone secretions, or to give her other hormones that will block the ovulatory cycle. Or if she feels a little bit of anxiety or depression, she goes on to antidepressant drugs or anti-anxiety drugs. Or they're given a diuretic to wash out the water and the salt. Or they're given painkillers to suppress the pain, or muscle relaxants to stop the cramps. I'm not saying those things should never be used, but if you look at the scientific literature and the clinical studies, there are many things that are based in nutrition and lifestyle and supplementation that are shown to really help women a lot, that bring the estrogen to progesterone balance back where they should be, and have been shown in clinical studies to be extremely useful at reversing PMS. And women need to know about this. One of the key ones is actually to do enough physical exercise. A standard physical exercise regimen has been shown to favorably modify PMS symptoms in terms of frequency and severity. So exercise has been proven to work to minimize the effects. How does it work? Well, what it does is it's going to help detoxify the extra estrogens. More blood goes through your liver because the blood's pumping faster. Your liver enzymes detoxify more of the estrogens. Also, the exercise raises brain levels of endorphins. It improves mood, it reduces anxiety, and just gives you a general feeling of well-being that's much more significant. And it has other effects on the body. So there are a number of nutrition, lifestyle, and supplementation factors that are all natural that have been shown to be very effective in the management of PMS. The problem is a lot of medical doctors don't see this when they're in medical school because the emphasis is so much on drugs, that a lot of patients never get the opportunity to see what they could be doing that's natural. So what I've done is I've created an ebook called The Natural Management of PMS, available right here. We'll show you all the comprehensive studies to show exactly what natural interventions are most useful to help reduce the symptoms of PMS and manage it more effectively. Exercise is certainly one of them. So if you have PMS, you should download it right now. Now, at machinohealth.com, you'll see my other research review papers, my other videos, footage from my live professional seminars, other resources and downloads I've created that will help you lead a long, healthy, functional life, which is really important. And all the research papers that I have and teaching materials have all the scientific references in them to make sure you're getting only sound scientific information on any health subject that you're looking for. So you really should make machinohealth.com an ongoing, reliable resource for health and wellness information for both you and your family members. Thanks so much for watching.